Good morning, class. Today we are going to start with another topic, that is diabetes mellitus. But before diving into the types and treatments, let's first understand a fundamental concept that underpins it all, that is blood glucose. What is blood glucose? Simply put, blood glucose is the main source of energy for our body. It comes from the food we eat, especially carbohydrates like bread, rice, and fruits. Our body carefully regulates blood glucose levels using two key hormones, that is insulin and glucagon. Insulin, which lowers blood glucose by helping glucose enter our cells, and glucagon, which raises blood glucose when it gets too low. Now, this hormonal control happens in the pancreas, which has tiny clusters called the islets of Langerhans. Inside these islets of Langerhans, beta cells and alpha cells are present. That beta cells are present in the center, which secrete insulin, while the alpha cell around the edges secreted glucagon. Insulin reduces the amount of glucose in the blood by binding the insulin receptors embedded in the cell membrane of various insulin responsive tissues called muscle cells and adipose tissues, which activated the insulin receptors causes vesicles containing glucose transporters that are inside the cell to fuse into the cell membrane, allowing glucose to be transported into the cell. Glucagon does exactly the opposite. It raises the blood glucose by getting into the liver to generate new molecules of glucose from other molecules, and also break down glycogen into glucose so that it can all get dumped into the blood. Great. Now let's look at the main types of diabetes. First type of diabetes mellitus is type 1 diabetes mellitus. This is an autoimmune condition where the immune system destroys those beta cells in the pancreas. This causes an absolute insulin deficiency. It usually appears in children, teens, or young adults. For the type 2 diabetes mellitus, the most common type, it happens because the body becomes resistant to insulin and there's a relative insulin deficiency. This type develops slowly, often related to lifestyle factors like diet and activity level. Moving on to other two diabetes types, that is gestational diabetes mellitus and juvenile diabetes. For gestational diabetes, this type develops during pregnancy, usually in the second or third trimester, we can say, and it often disappears after delivery but increases the risk of developing it later on as a type 2 diabetes mellitus. And for the juvenile diabetes, essentially the type is same as type 1 only, because in children it's all like the autoimmune condition, but specifically seen in children and adolescents only. That's why we are saying it juvenile diabetes. Remember this important point, that type 1 diabetes always require insulin therapy for life, while type 2 may be managed with lifestyle changes and medications. Let's talk about risk factors, things that increase the chance of developing diabetes. There are two main groups. First is non-modifiable risk factors. These include age over 45 years, having family history, ethnicity like people from Southeast Asia, African, Hispanics, Native Americans. Obviously, the patient having genetical history and the history of the gestational diabetes. For the modifiable risk factors, these are the things that can be changed, like person is having obesity, especially abdominal fat, then physical inactivity, just because of the sedentary lifestyle, then unhealthy diet, high blood pressure, dyslipidemia, smoking, chronic stress, sleep disorders, and PCOS. What do you think? Which of these do you think that nurses can help that patients to change? Of course, that modifiable risk factors. So, now, what sign and symptoms do we see in diabetes? Like the how the patient is presented to us. First, the classic triad is there for identify this type of patients. Majorly, patient complains about polyuria, that means frequent urination, polydipsia, that means increased thirst, and polyphagia, that is increased hunger. Other common symptoms include weight loss, fatigue, and blurred vision. And less common symptoms but important signs include slow wound healing and tingling or numbness in the hands and feet. Think of these symptoms as a warning signs of high blood sugar quietly damaging the body. How do we diagnose diabetes? We use specific blood tests for diagnosing diabetes. The first test is HbA1c testing, in which a level of 6.5% or higher indicates diabetes. Another test is fasting plasma glucose testing, in which a level of 126 gram per deciliter or more after fasting for 8 to 12 hours. And another test that can be performed in case of pregnant ladies, that is OGTT testing, that is oral glucose tolerance test. If 2 hours after drinking 75 gram of glucose, the blood sugar is 200 milligram per deciliter or higher, then indicates diabetes. OGT is specifically useful for diagnosing gestational diabetes and pre-diabetes. Now, moving on to the complications, diabetes can cause serious short term problems. That is, diabetic ketoacidosis, that is DKA, is common in type 1 diabetes caused by severe insulin deficiency. It is characterized by nausea, vomiting, abdominal pain, and a distinctive fruity ketone breath. For the second complication is hyperosmolar hyperglycemic state, as the name justifies it, in which severe dehydration takes place, hyperglycemia happens, that is mostly occurs in type 2 diabetes with blood sugar of 600 milligram per deciliter, but no ketone bodies were formed. The third complication is hypoglycemia, which means low blood sugar, that is below 70 milligram per deciliter. Mild symptoms include sweating and confusion. These need quick treatment within 15 grams of simple sugar. For severe hypoglycemia can cause unconsciousness and require an emergency glucagon injection. Other complications for diabetes mellitus are retinopathy, can cause blindness, nephropathy leads to chronic kidney disease, neuropathy causes numbness and tingling, cardiovascular diseases increases risk of heart attacks and strokes, and diabetic foot ulcers results from nerve damage and poor blood circulation. You know what happens exactly? That high glucose damages blood vessels and it weakens the immune defenses, which makes wound healing very difficult. We have learned about many things, that how it's happening, what led it to cause this disease and all, but let's learn that how to manage this condition. For managing diabetes, it's depend on the type. For the first is type 1, always need insulin therapy, and for the type 2 it is managed with lifestyle changes, oral medications, and sometimes insulin. Let's quickly review insulin and its type. For insulin, there are different types like rapid acting, short acting, intermediate, long acting, and premixed. Their onsets are different, their peak times are different, their durations are different, even their brand names are different. Even there are different tips for that. Like for rapid acting insulin, it is always given right before the food, and for the short acting, it's given for the patient with diabetic ketoacidosis, like for the IV use for that patient. For intermediate, it's like roll before use, like we have to roll it before the use. Like it depends, the types, their types depends regarding the condition of the patient. A helpful mnemonic for rapid acting insulin is rapid, that is right before the food. For oral medications, we can learn it with a very good mnemonic that I have. It's like some mighty big teachers always deliver sweet goods. Their initial letters we have to reframe, like S for sulfonylureas, M for meglitinides, P for buginides, that's majorly in the form of metformin, T for thiazolidines, A for alpha glucosidase inhibitors, D is DPP4 inhibitors, S is SGLT2 inhibitors, and G is GLP1 antagonist. As a nurse, your role is crucial. Monitor for the signs of hypo and hyperglycemia, reassesses patient pain, nutrition, and skin integrity, and educate patient on insulin storage and rotating injection sites and medication adherence. Also encourage lifestyle changes like healthy diet. You can advise patient to take complex carbs because that reduces the sugar spikes. Another one, take good amount of proteins and unsaturated fats that are also called good fats for the body. Ask the patient to avoid, even limit that refined food items or the processed food items. Tell the patient to do regular exercise, and brisk walk is the best for that type of patient, even the cardiovascular patient too. And you tell them to wear proper footwears to reduces the risk factor of diabetic foot and all. Avoid smoking and alcohol, manage stress of the patient, and regularly monitor blood glucose. These changes can be adapted by the patient to just lead a good life. Diabetes is a chronic but manageable condition. As a nurse, your involvement in early detection, patient education, ongoing management can truly change his life. Let's do a quick recap. Can anyone tell me the three classic symptoms of diabetes? Wait. Write it on your notebook and just recap and check your answer. Thank you for your kind attention, and I look forward for the next session. Till then, keep learning.